You're most welcome.
I'm sorry. Yeah. Okay. This project was the same project but as previous presenter explained, and the project purpose is here. Milk hygiene is improved and the production increased in the target group of dairy farms in Mbarara district. And these circles show the participated farms, and the target group is the 30 project activity dairy farms under the Uganda Crane Creameries Cooperative Union and other dairy farmers belonging to Milk Collection Center cooperatives in Mbarara district. And as explained by the previous presenter, the project has 3 components, and this study is from mastitis control and milking hygiene. And project timelines like this: baseline survey, intervention, and endpoint survey. And today, I'm going to talk about the baseline survey result. And the objectives of this study is to reveal subclinical mastitis prevalence and its risk factor associated with milking practices. So material method. Farm information of herd size, milk yield, herd management types were collected, and milking practices and hygiene were checked by observational checklist survey. And also California mastitis tests were performed to screen subclinical mastitis, and T-end score was also performed. And quotas for who has food CMT score were 2 or above were performed for microbial culture. And the correct data above analysis was performed. First, the descriptive epidemiology analysis. I'm sorry. The second, causal effect of milking practices to subclinical mastitis at the cow level and quota level using multivariable analysis. The third analysis was relationship between milking hygiene management and the infection with contagious or environment pathogen in subclinical mastitis among quotas from which microbes were isolated using univariable analysis. So the statistics used was, for univariable analysis, generalized linear mixed effects model were used with binomial error. And for multivariable analysis, the first step univariable analysis was performed, and then the factors whose p-value were less than 0.2 from univariable analysis were fed into the multivariable analysis. And also confounders that were identified by causal diagrams were forcibly into the model. And then backward model simplification was performed. This multivariable analysis was also performed using GLMMS. The result, so all the farm were performing hand milking, and grazing farm was 93% of the participants. And this table shows the result of herd size parity, milk yield, body condition score of mean, median, and range. The average herd size was 35, and parity was 2.7, and milk yield was 9.5, and body condition was 3. So this picture shows one farm of the participants. This table shows the milking methods and hygiene management. So basically, cows are clean and relaxed, but the milking practices to control mastitis, like hand disinfection or wearing gloves, or pre-milking, pre-dipping, and drying teeth were not well performed well. But milking practices itself, during the milking, the cows are not hate to be milked, and they are relaxed. But post-dipping, the performance level was low. So this is the result of CMT. And at the individual level, subclinical mastitis 68.6% was positive. And at the quota level, 39.2% was positive. And this graph shows the result of microbial test. And the most prevalent was Corynebacterium bovis and Staphylococcus aureus and CNS at following. And among them, 76.2% were contagious pathogen when CNS was included as contagious. But if it's excluded, it's still 66% was contagious. So this is a T10 score result. Score 1, normal teeth, like this, was 81%. And score 2, like this, was 70%. And score 3, 2%. And score 4, 0%. So this is the causal diagram built for multivariable analysis. And by the factors whose p-value were 0.2 at the univariable analysis were fed into the multivariable analysis as exposure variables with these circles with triangles. And this is subclinical mastitis was set as outcome variable. And also including those other factors which related to this relationship were added to build a diagram. And from this, how to squeeze teeth and milk yield was detected as confounders. So these two factors were forcibly into the multivariable analysis. And model simplification was performed. This slide shows the final models for multivariable analysis at the curl level here and at the quota level below. And this table shows the observation number and cluster-specific odds ratio, confidence interval, and p-value. And at the curl level, curl relaxed at the end of milking was a preventive factor for subclinical mastitis. And at the quota level, rough teeth end was a risk factor for subclinical mastitis. And this slide shows the result of analysis 3, which is a relationship between milking hygiene management and the infection with contagious or environmental pathogens in subclinical mastitis. So this analysis was performed in two ways. One is classifying CNS as a contagious pathogen, and the other is CNS as environmental pathogen. Because CNS are from both skin flora and also the environment. And when it classified as contagious, 1 towel use per cow for teeth wiping was negatively associated with contagious mastitis. And cow hygiene, good cow hygiene was positively associated with contagious pathogen, meaning it is good cow hygiene is negatively associated with the environmental mastitis. Because in this study, only quotas which bacteria or microbes are isolated was used. So the proportion here, 1 minus the proportion indicates the environmental mastitis. So when CNS was classified as environment pathogen, the significance of towel use was disappeared. Only cow hygiene was remained. So suggesting that CNS in this region plays a role of contagious pathogen. So discussion. High prevalence of subclinical mastitis was observed in Mbarara district, Uganda, and high proportion of contagious bacteria were observed. From these facts, production loss and low milk quality from mastitis is concerned. from risk factor analysis, cows relaxed at the end of milking was a preventive factor, and damaged teeth end was a risk factor. And not to damage teeth, a proper hand milking technique is required. And use of 1 towel per cow was negatively associated with contagious mastitis. And also bad cow hygiene was associated with environmental mastitis. Therefore, for interventions, preventing cow-to-cow infections and improved cow-shed environment should be considered in the dairy area. So from the results the project made this kind of intervention package brochure using the evidence of, how can I say, the squeeze method or, 1 towel use and how to wipe teeth, and post-dipping, towel washing after use, and this is used to distribute the information to the farmers participated in the area, and also other populations in the area. Okay. This study was funded by Japan International Cooperation Agency, and also special thanks to other Mbarara District local government, Uganda Creamery Cooperative Union, Ministry of Agriculture, Animal Industries and Fisheries of Uganda, Dairy Development Authorities, and Makerere University. Okay, thank you very much.